Anyway, welcome. I'm Jon Karon of the KJC Law Firm, and today I'm delighted to have as my guest Jeffrey Manning, a physician in Rhode Island with extensive experience treating people who suffered from concussions as well as many other things. And Jeff is going to talk to us today about some of the significance that having a concussion may have, and also how to recognize that something's going on that you may need to get looked at. None of which does him justice. So let me introduce Dr. Jeff Manning. And Jeff, can you tell everybody where you practice these days and what you presently are up to?
Absolutely. So I practice a mix of musculoskeletal health and sports medicine at a practice called Coastal Medical, which is located in Rhode Island. But I can give you a little bit of a background on me and where I came from. So I did my, prior to going to medical school, I was actually a teacher and coach for a high school down in Florida. I coached football and lacrosse as well as taught chemistry. And then as my second career, I started that by going to medical school at Penn State. I did my residency in family medicine at Brown University. And then I did a sports medicine fellowship at University of Massachusetts. And since that time have been treating predominantly sports medicine or basically non-operative orthopedic patients and concussion patients.
Okay. Now, your practice recently has sort of shifted away from the treatment of concussions. Is that right?
Yes, I don't treat as many concussions now as I used to, but that used to actually be one of the primary staples of my practice.
How did you get involved treating concussion patients, Jeff?
That's a great question. Concussion is something that really came to light with our general population through sports in a lot of ways. Back in 2001 was the time that Bennett Omalu, who is a pathologist, started looking into these repetitive brain injuries. He's the physician who Will Smith played in the movie Concussion. And essentially, it really came to the forefront of our popular culture with football players. And that became a big part of my training, which was later on from 2006 to 2010, where we really started to focus on this because it was something that had been underdiagnosed, undertreated, and it was also something that everyone was talking about because it was a topic in the National Football League.
Well, and I actually read the book that they made the movie out of. Now, a lot of what that concerned was what they call chronic traumatic encephalopathy, right?
Yep.
And that's sort of the long-term dementia stuff like Junior Seau suffered from and some of the other noteworthy folks. But can concussions be serious even if you don't have the multiple repetitive concussions that might down the road result in you developing CTE?
Absolutely. So CTE is something that is the very, very small sliver of people who have had concussions. And that's repetitive brain injury over and over again. But what's much more common is an athlete or somebody on the job sustaining a head injury and then realizing that they're not quite right. It's something that I had learned a lot about in my training, but I don't think I fully appreciated what a concussion was until I got one. I don't know if you want to hear that story or not.
I do. I didn't know that you had actually had one yourself. How did you end up getting a concussion, Jeff?
Sure. So as I said, I had read a lot about concussion. I had treated a fair number of patients with concussion. If you had asked me if I'd ever had a concussion prior to me actually getting one, I would have told you, well, I played football in high school and in college, and I've seen stars, and I've probably had one. But then I actually got one, and I realized that it's totally different and it's a much bigger deal than I even ever appreciated. What happened was my wife and I were mountain biking, and we were mountain biking in the woods on these very tight trails. And we had gone up a really steep hill, and my chain came off of my bike. And so my wife saw that my chain had come off the bike, and she went down the steep incline and figured that I was just going to walk my bike down. Well, what I did was I put my chain back on at the top of the steep incline, and then I rode my bike back down, and I was flying down this hill, and really you had maybe 4 feet of trail, and I turned the corner, and in a split second I saw my wife standing there in the trail next to her bike, because she thought I was going to be walking the bike down. And it was one of those sort of split second decisions where I just turned the bike off the road, and I ended up hitting a tree. And so my wife, who's also a physician, came over to me, and I was bleeding down the side of my face, and my helmet had cracked all the way up the side, and I was disoriented, and she was really scared. Thought maybe we might need to call somebody to get me out of the woods, whether or not I had a neck injury or if I had a serious head injury. So she watched me for a little while until we felt comfortable that I could get up and move. I was able to walk out of the woods on my own, but I did not feel right. And even as a physician who diagnoses concussion and treats people, I mean, in retrospect, this is going to sound ludicrous, but I didn't diagnose myself with a concussion. I mean, I felt foggy. I didn't feel quite right, but I said, this will wear off. I'm going to go to work. And, I went to work the next day. I was a resident at the time. And I remember my first patient of the day was telling me the medicines they were on. And from them telling me a medicine to me trying to enter it in the computer, I could not remember what they had told me. And so immediately I said, this isn't okay. I should not be seeing patients today. I excused myself from the room. We had a different doctor take over care of that patient, and I had to go home and be out of work for, I don't remember exactly how long it was, but that really gave me new insight into how serious this is and how disabling it can be, and how profound the impact can be.
So let me just see if I've got this straight. So you were a doctor, you were a resident at the time, and it took you until well into the next day before you realized you were concussed. Is that right?
Yeah, that's absolutely right.
Did you lose consciousness after you hit the tree?
I did not. And that's actually a popular misconception that in order to diagnose a concussion, you have to lose consciousness. In fact, hopefully it's not being taught anymore, but that was something that, folks have been taught that, we often have to correct.
So did you end up eventually seeing another doctor for your concussion? Did you get checked out yourself?
I did. I got checked out myself. And I think I spent around a week out of work, and then I was feeling a lot better. I didn't do any physical activity. I really took it easy even once I got back into work, and very fortunate for me that it only took me around a week, maybe a little bit more to feel 100% myself. But I've got to say, in my experience seeing patients, I was lucky. And that's not the case for everybody.
Well, I'm going to give you what I know is a softball question, but I don't think our audience will until you answer it. So I played football as a kid, not particularly gifted, but good enough that I occasionally got into a game. And I can remember, getting what I thought was probably just getting my bell rung. So Jeff, isn't getting a concussion when you're playing sports, isn't it just like, you just got your bell rung, walk it off, go back in the game. Don't be a wimp about it.
That, believe it or not, that's still part of the culture in some sports. But no, absolutely not. That's not the case. I actually authored an article. It's not just getting your bell rung, which tries to explain that exact distinction. Um, you know, I think that we've come a long way over the past, 20 years or so, in that now I think concussion is much more widely recognized. People know about it, people ask about it, coaches know, athletic trainers know, physicians know, but it is something that, we still have to remind folks that, if you suffer a head injury, certainly if you lose consciousness, if you don't feel right, absolutely, from the sports context, should not return to the game and need to be cleared before doing any athletic activity.
And specifically, Jeff, because I'm imagine that some of the people watching this will probably be either athletes themselves, whether, weekend warriors or whatever, or parents with kids who are playing sports, or frankly are just kids. Can you tell people what are the things you should look for that would tell you that there's something potentially serious going on?
Yeah, absolutely. So obviously there's a prerequisite for an injury, but oddly enough, it doesn't necessarily have to be an injury to your head. And so you could have a whiplash injury where, you're thrown back and then you come forward. You never hit your head on anything, but that whiplash injury can affect the way your brain sits in your skull. And so you can still get a concussion that way. Obviously.
Can you explain that one a little bit more for folks? I think I know what you're talking about, but
Sure.
haven't heard that one.
So, essentially your skull is a hard container that's filled with liquid, and inside that liquid is your brain. And so you can imagine that, if you've got this thing floating in liquid, if you were to move it back really quickly and move it forward, that thing is going to knock up against the sides of that solid container. So even though you might not strike that container, the thing inside the container still moving in that fluid and can hit back and forth against the walls of that container.
So, in other words, even if you don't hit your head, you still have to be aware, or your family needs to be aware, that there's a possibility that you could still sustain a concussion. Is that right?
Yes, specifically a whiplash injury that involves your neck. I mean, if somebody comes in and hits your knee or something like that, you don't have to worry about it. But yeah, anything that involves the head or neck. Another thing to be aware of is a lot of times folks, they're so traumatized from the incident, like with a car accident or something like that. And they'll have somebody, well, did you hit your head? Did you hit your head? And they say, well, I don't know, or I can't tell. If they're having symptoms that are consistent with concussion, such as headache, sensitivity to light, feeling slowed down, not sleeping well, difficulty concentrating, then, I would always assume concussion until proven otherwise. Because, oftentimes there's a whiplash injury, or sometimes in the moment, someone may strike their head and they may not even realize it. I mean, I've had patients that, it was only because of the welt on their forehead that they realized that they had struck their head. They'd say to me, well, I don't remember hitting my head, but gosh, I had this big welt, so I must have.
Okay. So why is it important to recognize that you may have a concussion? I mean, you gave us some good things to look for, but why is that important? Won't people just get better anyway?
Well, I mean, fortunately, the vast majority of folks do get better with rest, but there is a small percentage of folks that the symptoms can linger, and that percentage of folks whose symptoms linger goes up dramatically if they try to push themselves both physically and or cognitively. And what I mean by that is, if you say you're an athlete, and you don't necessarily have to get your head injury in the context of sport, say you're doing some work on your house and you fall off a ladder and you hit your head. Well, you're a runner and you decide to go running the next day after your concussion. That can really exacerbate your symptoms, can make them worse, and it can also prevent you from healing as quickly. Another anecdote I have, I don't know how much time we have, but I can tell you another quick.
Take your time. I want to hear this one.
So I had a high school football player who suffered a concussion in a football game, and he came to me, and the cornerstone of treatment for concussion is physical and cognitive rest. So brain rest essentially, but also rest from physical activity. And we were doing everything right, I thought, and it had been several weeks, and he continued to have these bad headaches, difficulty concentrating, and sensitivity to light. And over the course of weeks, he just didn't seem like he was getting better. And I kept saying to him, "All right, so okay, you're not doing anything, you're not playing sports, you're not doing things physically. Nope, not doing that, not doing that." And I was really puzzled by why he wasn't getting better, because the other things we look at, he was getting good sleep, he wasn't depressed, he was taking it easy from the academic load, things like that. And my second to last visit with him, he stood up and completely, like, the visit is done, and he says, "Oh, doc, something I got to tell you. I did really well in my powerlifting competition this past weekend." And I said, "Hold on a second. Your powerlifting competition? I thought you weren't playing sports." And he said, "Oh, well, I was just weightlifting. It's not really a sport." And so, it sounds ridiculous, and clearly there was a communication issue. But I immediately said, "Listen, that counts. You can't be lifting weights. You got to stop everything. I'm going to see you back in 2 weeks." 2 weeks later, I saw him in follow-up. He felt fine.
So I think you mentioned something that a lot of people, I'm not even sure I knew about, which is, I think a lot of people think, and your patient did, that if you sustain a concussion, that the whole don't return to sports thing is just all about, we don't want you to hit your head. But there's more going on than that, isn't there?
Absolutely. Yeah, absolutely.
Why is it, what else, what's going on that makes the activity a problem, even if you're careful not to re-injure yourself?
Sure. Great question. And I don't know that any of us know this certainly, but there's several hypotheses about the blood flow to the brain, how it's compromised initially after the injury. Certainly exerting yourself, we know, will increase symptoms, and exerting yourself can be as simple as increasing your heart rate with something like running. What I try to tell folks is, if you're provoking symptoms, you're not getting better. So you're essentially actively working against yourself. And without getting too technical and boring people with things, there's something called the Buffalo Concussion Treadmill Test, which is essentially a graded return to activity, having people do some work on the treadmill, starting off very slowly and then increasing with time as long as they're symptom free. And that's a way to get people into a graded return to activity protocol.
So is that the kind of thing that a concussion specialist like yourself can work with people on? In other words, helping them determine when it's safe and healthy for them to resume activities, and sort of, getting them back into being able to do as much as they can as quickly as they can.
Yeah, absolutely. But I would be remiss if I didn't say that it is a team sport. It is a team approach, I should say. So taking care of concussion patients involves an entire team of clinicians. The physician is only one piece of it. The physical therapists do a tremendous job. They are the ones who actually would administer something like the Buffalo Concussion Treadmill Test. Physical therapists also work with folks who have neck injuries that often come along with the head injury. And the neck injuries can really muddy the water, because if you have a lot of spasm in your neck, you can get something called tension headaches, which start in the back of the neck and radiate forward, which sometimes can be confused for concussion. We have psychologists, because oftentimes people will experience anxiety and depression, one, as a result of their head injury, but two, as a result of the treatment. So being asked to rest both physically and cognitively, well, now you have somebody who's not going to work or not going to school. They're probably seeing people less socially. They're not participating in the sports or the physical activity that makes them feel good. And so that becomes a major part for people. So we have our psychologist partners that are helping us with that. Really it's this effort by physicians like myself, sports medicine physicians, physical therapists, behavioral health providers. And sometimes when there's a concern that there's more than a concussion going on, I will often consult my neurology colleagues. So it's something that you really have to be prepared for, a full holistic approach to this.
When you said sometimes when you're concerned that there might be more than a concussion going on, what are you looking for there, or what do you get concerned about?
Certainly. So when someone presents initially, it's very important to make sure they don't have a bleed in their brain. And that's something that, could potentially be catastrophic. And so when you have somebody who has an acute injury, specifically somebody who seems to be deteriorating over time, that's somebody who, really needs to have a scan of their brain to make sure there's no active bleeding. And not everybody who has a head injury and you suspect a concussion needs a scan, but that's why these patients often need to see a doctor as soon as possible, because there are certain telltale signs. For example, somebody who's injured and seems to be with it, and then over the next few hours really starts to deteriorate. Anybody who's got some sort of neurological compromise, whether it's numbness in their arm, leg, you always have to be careful about a cervical spine injury. So that may present in other ways.
So those are folks who need to get themselves to the emergency room like immediately, right?
Absolutely.
So let me ask you this, and this I know there's been a lot of publicity about, so hopefully most people at least have some understanding about it. But we talked about how it's important to allow yourself to rest both physically and cognitively to help yourself recover. But there's also the risk of subsequent re-injury or subsequent concussions if you return to play too quickly, right?
Absolutely.
Can you just tell folks a little bit about that? And probably a lot of folks watching hopefully know about that and why that's a problem, but it's so important that I think it'd be good if folks heard it again. And if you already know this and you're watching, bear with us, because I think it's an important message.
Well, I think what you may be getting at, and correct me if I'm wrong, but you want to make sure you're absolutely symptom free and you're ready to return before you return. But something that I've seen in my clinical practice is that the more concussions that one sustains, the lower their threshold is to sustain another concussion, meaning that they are more vulnerable over time as they have these repeated injuries. And often the duration of symptoms and the severity of symptoms will increase over time as well. Now, that's not to say just because you've had one concussion, you're guaranteed to have a second. But when you've had your third concussion, in my experience, it's more likely that an injury to your head could cause that fourth concussion than if you're somebody who's never been hit in the head and you may suffer that same type of hit.
Okay. Well, no, I think that was probably even better than what I was getting at, and certainly more accurate because you're the doctor. Let me ask you this. I'm curious, in your practice, you've certainly treated a fair number of athletes, I imagine, and probably a decent number of teenagers and young adults. Have you ever had an issue with something I've encountered with a lot of those folks, which is what I would call faking not having an injury? And I don't mean it like sinister, but they just really don't want to be hurt, and they really want to be able to return to sports or school and before they're ready. And is it ever hard for you to get them to admit that they're still having symptoms?
Absolutely, without a doubt. And that's one of the real difficult pieces of this. And that's where people talk about medicine as being a science, but certainly also equal part art. And so being able to connect with patients, having them trust you is a significant part of this, and having them understand that you're on their side. You're not trying to hold them out. You're not trying to ruin their athletic careers or their social lives. But it is a difficult piece. One tool that I will use, or I used to use, and just because I don't see as many concussions now, I'm not using it currently, but there are different computer-based cognitive tests. There's also formal neuropsych evals, which can be done with a neuropsychologist. And getting an assessment of somebody's cognitive abilities can give you some clues as to whether or not they are where they should be, regardless of what they're telling you. Obviously, it's always useful to have a baseline understanding of where somebody's cognitive abilities are prior to sort of assessing them and comparing. But that's a piece where I will oftentimes rely on my neuropsych colleagues. And I think I left them out of the team before, but they're probably one of the most important people on that team. So yes, the neuropsychologist who's able to assess folks.
Well, let me ask you this. Before, we've talked about both how you recognize if you might have suffered a concussion and the importance of not ignoring it. But if you think that you might have suffered a concussion, or if you're a parent, you think one of your children might have suffered a concussion, what should you do at that point?
Yeah, I mean, absolutely want to have them evaluated. Certainly taking them to your primary care provider. I think one of the best things that's happened recently with all the publicity concussion has gotten is that it's really gotten out into the mainstream. I work with tons of primary care providers, pediatricians, family doctors, internists, and I think that folks are really tuned into this in general. And certainly folks like myself, sports medicine physicians, neurologists. There are a lot of folks that have expertise in this. So, getting evaluated is number one. And if you're being evaluated with a clinician who, doesn't have a lot of experience or isn't comfortable with concussions, they'll make sure you get to the right place. But I think, just telling someone and being honest about it, because you're right, there are a lot of folks, and again, it's nothing sinister, but they want to be working, they want to be playing, and there's a certain personality type of folks that I see that I actually have a ton of respect for, and they are folks that are just hardworking and have sort of sucked it up their whole lives, and they've been tough, and they're the kind of folks who they put their head down and they get their work done and they don't complain. These are the kind of folks that I love to work with. When I was a football coach, they were the kind of folks that I love to coach. But those folks are the ones that I usually end up seeing 2 months after they had their injury, when they're in a lot of pain, when they've stopped being able to go to work, and they feel really defeated. And, part of it is letting them know that it's not their fault. And, this isn't different than if you had something like a heart attack. I mean, I've used this example with people. I say, because they come into my office and they're dejected and they're like, I can't go to work. This isn't me. I'm tough. And you say, listen, if you had a heart attack and you were in the hospital, would you be expected to go to work? Would you be forcing yourself to try to do these things? And they say, well, of course not. And I think that concussion is a little different in that you can't see it. And that's the thing that's so difficult. And there isn't a test like an EKG that's going to tell you that you're having a heart attack, that's going to tell you definitively that you're having a concussion. And so that's the piece that I think there's still some difficulty with, and maybe even some stigma around, is that it's your own report of how you're feeling. And for some folks, to admit that you're not feeling well is showing vulnerability, and that's not comfortable.
Wow. Well, Jeff, this has been very, very good information. And so the only thing I'd like to do now is as we wrap up, is there anything, because hopefully our intended audience is people who may be at risk of a concussion because they're active athletes or parents of children or just people who are interested. But is there one or two messages that you'd like to be able to convey to folks that you think they should know about concussions that would be particularly useful or maybe aren't as well known or well understood? Is there anything, and giving you your last chance, is there anything you'd really like to make sure people get out of this?
Well, I mean, I think that we've done a nice job sort of covering a lot of different topics within this broader category. But one thing we didn't touch on that I think is really important is the importance of sleep. A lot of folks after a head injury find that they're not sleeping well. And when you're not sleeping well, you are going to prolong these symptoms and it's going to be much harder to get better. And if you're not sleeping, it's almost guaranteed that you're not going to get better. And so that is probably the thing in clinical practice that I learned on the job. It wasn't something that I read in a textbook. It wasn't something that a mentor told me, but I would always ask about sleep because a lot of the folks that I would see were the people that had symptoms for months and months. And so getting down to the bottom of why they're still not better is not an easy thing. But sleep was probably the number one reason I found that people weren't getting better.
And are some of the sleep disturbances amenable to treatment?
Certainly. That could be a whole nother talk, but I think that briefly, it has to do with the anxiety. So if somebody's staying home, they're not working, they're feeling really anxious. Financially, you're pressed when you're not working because you're doing what the doctor told you, you're not doing it. You don't have those outlets for exercise, and maybe that makes you tired and that makes you less stressed. So that can keep you up. I mean, just in general, people with head injuries, sometimes they won't sleep as well. Sometimes people are coping with substance, so alcohol or other substances, which can not only potentially limit your improvement in your concussion, but also injure your sleep. So yeah, that's a whole big topic, but I guess my message is one, recognize that something's wrong and don't be ashamed of it. And two, get treated. And then number three, I just felt that I had to mention sleep because I think it's so important and it's something that not a lot of folks talk about.
Well, Jeff, perhaps sometime you would be willing to come back, and I think that could be a topic of a whole podcast in and of itself. And I can think of a number of questions I already have, but I think this one will wind down, but maybe I could talk you into coming back in a little while and telling us a little more about the effect of concussions on sleep and how clinicians like yourself try to help people who have those problems. Do you think I might be able to persuade you to do that sometime?
Yeah, it would be nice if it was in person rather than over Zoom. I'm waiting for the day when we can do that.
That would be fantastic, and me as well. So, Jeff, I'm going to thank you. My guest today was Jeffrey Manning, a sports medicine and musculoskeletal. How would you describe your current specialty these days, Jeff?
Well, I mean, it's sports medicine, but I treat only a small percentage of the people I see are athletes. I'm more into the musculoskeletal end of sports medicine now, where I'm treating people with injuries or chronic musculoskeletal disease like arthritis, rotator cuff injuries, things like that.
Well, those are also, I don't want to say interesting injuries because it feeds into the stereotypes of lawyers who do what I do for a living, but the medicine there can also be pretty interesting. Maybe I'll have you come back and talk about some of that medicine in a future date. But amongst Dr. Manning's expertise is also the area of concussions, and the author of Concussion, It's Not Just Getting Your Bell Rung. That was in the Rhode Island Medical Journal, right, Jeff?
Yep.
Okay. Well, thank you for joining us today. And I'm Jon Karon from the KJC Law Firm. I hope that everyone has found this useful, and hopefully we'll be able to continue to provide some stuff to you that's of use. Thank you again, Jeff, for joining us.
My pleasure.